Hello, my name is Dr. Lee Lindquist, and I'm Chief of Geriatrics at Northwestern Medicine here in Chicago, Illinois. Plan Your Lifespan is celebrating a huge milestone. We're turning 10. So it's been 10 years since we first launched Plan Your Lifespan. And for those of you who are not aware, I can't believe it, but Plan Your Lifespan is a website, an online tool that we developed to help older adults and their families plan for their futures. So do you know what you'll need in your 70s, 80s, and 90s as you get older? And we're not talking about the 6 months before you die, which we consider end of life. We're talking about the 10 to 20 years before, when you might need help in the home, or you might need to have somebody help you after a hospitalization, or you're experiencing worsening memory loss. So this is helping seniors get their voices heard so that they can get what they want down the road. It's been randomized, it's been in a randomized controlled trial, which is where we tested it out to see if it actually made an impact in seniors' lives. And we have shown that Plan Your Lifespan, or the use of Plan Your Lifespan, helps older adults figure out what they know for the future and figure out what they want to plan for down the road, as well as share those plans with loved ones. So it helps with knowledge, it helps with communication, and it helps with planning. After we showed that it was effective, we were lucky enough to receive 2 further CORI grants as well as an NIH grant. This is nice money that actually helps us down the road further understand what seniors need to age in place and to make decisions about their future. So we have a long-term study going on where we're taking people and we're following them as they've used Plan Your Lifespan to see what's making their big decisions to implement these plans. We also have further funding where we got to disseminate Plan Your Lifespan, and that was huge. We actually got to disseminate it through our patient panel, through our caregivers, through different community groups. And we were able to reach so many different areas. We reached all 50 states. We've gone international, people in South Africa and Europe, in India, Australia, New Zealand. People have used Plan Your Lifespan, and it's just phenomenal. We've had over 700,000 hits to the website. And luckily for us, Epic Electronic Health Records in Verona, Wisconsin reached out to us and asked to include Plan Your Lifespan in their patient pages. So if you want to go on your Epic patient page or the My Chart page, you can actually find a link to our website at the bottom of the advanced care planning. So Epic thought it was a great resource for patients and included it. So besides using it through Epic, you can actually go directly to our website, which is planyourlifespan.org. Completely able to be used, and it's free. There's no charges involved. There's no collection of data on you, and it's just open and available for you to use. So Plan Your Lifespan is great for patients, for family caregivers, for family members of patients, as well as physicians and nurse practitioners, providers. Primarily because if you're a busy clinician, you can actually send patients to this website, planyourlifespan.org, and they can use it on their own time, and they can read through it. And some people have given us feedback that it's like a virtual social worker. So it talks through what you need, and it actually connects you to resources. So you can actually put in your zip code and find out where the resources are in your neighborhood. So it's nationally available, but it's also centered on the person and where they're at locally. Since the 10 years have gone by from when we first started building this till now, people are using computers much differently. And many of us have seen seniors, using computers differently as well. What we're seeing is that more people are using the mobile phone, the smartphones. And so we've actually morphed the Plan Your Lifespan website into a new version celebrating our 10 years. And in it, you can actually use it on your mobile phone, your smartphone, and you can actually use it in a large computer. And we actually use more scrolling than we did 10 years ago, and so that's reflected, as well as different language. So you can actually see things in different versions. So a common question I hear is, what are we going to do when you start needing more help in the home? And some people don't even want to touch that question because it's a little scary, but we do need to talk about it. Do you want to live with, a helper in your home? Do you think about moving in with a loved one? And that was an eye-opening experience for us because we had so many seniors that said, I plan on moving in with my daughter or my son. And when we asked the children, they were like, what? I had no clue that I was going to be having, my mother or my father move in with me. So there is this disconnect in communication. So that's one thing that Plan Your Lifespan is very good at, is opening up that communication, that discussion of what are we going to do when you get older and you may need help. Because it's better to plan ahead and have your voice heard than waiting till something critical and you're in the hospital or your memory is so bad that you're forgetting everything. It's important to establish what we want as we age. As we launch our new version, which I'm super excited about, we expect people to look into it again to say, you know what, the last time I did this was 5 years ago, or the last time I made these plans was 10 years ago. And we all know things change in those 5 or 10 years, such as COVID. So many things have impacted how we think about our future. And so it's important that people revisit planyourlifespan.org and think about what they'd like as they get older.